My name is KBarrett. This is my case study project presentation number 1 for this course. My client will be referred to as Client J. He is 3 years old and has an autism diagnosis. His behaviors of concern include aggression, crying, elopement, flopping, property destruction, self-injurious behaviors, tantrums, and yelling. Client J does have emerging vocals with significant deficits in his functional communication skills, social skills, as well as high rates of repetitive and stereotypic play that do impede his learning. First, we'll focus on his barriers to learning. We've used both indirect and direct forms of measurement, including parent and caregiver interviews, ABC data, and direct observations to determine the following operational definitions and estimated functions for the behaviors of concern. The first is aggression. Aggression is defined as any instance in which Client J physically hits, pushes, kicks, bites, pinches, headbutts, or otherwise puts any of his body parts on another person with force without permission. We count each attempt and/or success. The estimated function of this behavior includes access to preferred items and escape from demands. The second behavior is crying. Crying is defined as any episode in which Client J produces visible tears, either welling up in his eyes or streaming down his face. This behavior will be recorded with episodes. An episode ends when he is no longer producing visible tears for 30 seconds. The estimated function of this behavior includes access to preferred items and escape from demands. The next behavior is elopement. Elopement is defined as any episode in which Client J moves more than an arm's distance away from the therapist without permission to do so. This behavior is measured using frequency of episodes. Each episode ends when Client J is next to his therapist and is no longer attempting to engage in that elopement. The estimated function of this behavior includes access to preferred items and escape from those demands. The next behavior of concern is flopping. Flopping is defined as any episode in which Client J goes from a sitting or standing position to a lying on the floor position without permission and/or outside of the context of play. This behavior is measured using frequency of episodes. Each episode ends when Client J resumes to the original seated or standing position without the support of another person for 30 consecutive seconds. The estimated function of this behavior includes access to preferred items and escape from demands. The next behavior is property destruction. Property destruction is defined as any instance in which Client J uses his hands and/or feet to make contact with any surface or objects with enough force to audibly make a sound, and/or rips, throws, tears, or breaks items. We count each instance. The estimated function of this behavior includes access to preferred items and escape from demands. The next behavior of concern is self-injurious behaviors, or SIB. SIB behaviors are defined as any episode in which Client J hits, bites, pinches, scratches, headbangs, or otherwise makes contact with his own body in an inappropriate way, which may or may not leave a mark. This behavior is measured using frequency of episodes. Each episode ends when Client J is no longer making inappropriate contact with himself for 30 consecutive seconds. We count each attempt and/or success. The estimated function of this behavior includes access to preferred items, escape from demands, and attention. The next behavior is tantrum. Tantrums are defined as any episode in which Client J engages in 2 or more of the following behaviors at the same time. Looking at that: aggression, crying, elopement, flopping, property destruction, self-injury, or yelling for a time greater than 30 seconds. The episode ends when Client J is no longer engaging in 2 or more of those behaviors for 30 seconds. The estimated function of this tantrum behavior includes access to preferred items and escape from demands. The last behavior is yelling. Yelling is defined as any episode in which client J produces sounds or vocals that are loud enough to be heard in the next room. The episode ends when client J's sounds or vocals resume to that of a normal speaking volume or lower for 30 consecutive seconds. The estimated function of this behavior includes access to preferred items, escape from demands, attention, and automatic reinforcement. The assessment tool of choice we used was the Verbal Behavior Milestones Assessment and Placement Program, or VBMAP, which is a well-known assessment tool that is designed for children with autism and other individuals who demonstrate a language delay. It includes a curriculum guide as well as a skill tracking system that provides a baseline level of performance of the learner that can then be used to develop a framework going forward for planning individual curriculum. The first part of this assessment that we'll be discussing is the milestones assessment. As you can see for client J, the yellow shaded boxes are the results from that initial evaluation of client J's skills prior to beginning ABA intervention. The orange shaded boxes you can see represent the skills acquired during the first 6 months of ABA intervention, and the brown shaded boxes are those skills from the most recent assessment of client J's milestones. He's making significant and steady progress over many different areas, including MAND, tact, listener, as well as social skills. The second part we'll look at is the barriers assessment. These barriers are preventing client J from making even more progress on those milestones and transitions. My client displays barriers in all of the areas tested, with the most significant being defective MAND, defective tact, defective listener, defective intraverbal, and defective social skills, as well as prompt dependency, scrolling, and some others that you may see. He scored a total barrier score of 85, which is preventing him from making those other strides in other areas. The third part of this assessment is the transitions assessment. My client scored 17 points overall on this transitions, but the greatest areas of strength, including adaptability to change, range of reinforcers, VBMAP milestone score, social skills and social play, as well as self-directed leisure time. We will continue to focus on strengthening and building these transition skills. Overall results of this assessment. Client J presents with significant areas of deficits that would make learning in a less restrictive environment very difficult for him at this time. The VBMAP assessment outlines specific goals and a treatment direction in order to help decrease these barriers while strengthening and building the transition skills that he needs so that client J can be successful in a less restrictive environment in the future. These are my references for the presentation. Thank you very much.